Imagine living surrounded by clutter that causes constant stress, embarrassment, and even health risks, but feeling powerless to throw anything away. This is the reality for millions with hoarding disorder, a misunderstood condition that goes beyond messiness. In today's video, you'll learn what hoarding disorder really is, how it affects people, why it happens, and how recovery and hope are absolutely possible. What is hoarding disorder? Hoarding disorder is characterized by persistent difficulty discarding or parting with possessions, regardless of their actual value. This leads to cluttered living areas, making daily functioning difficult or unsafe. People with hoarding disorder often feel intense anxiety or distress at the thought of losing items they may also see. Collect items excessively or have poor organizational skills. It's classified as a mental health disorder, distinct from collecting or simple laziness. Common signs and symptoms: accumulation of items that clutter and crowd living spaces, which reduces their intended use. Difficulty discarding items due to perceived need or emotional attachment, distress or indecision related to sorting or discarding possessions. Significant impairment in daily tasks like cooking, cleaning, or sleeping. Social isolation or embarrassment about the clutter. Possible health and safety hazards: fire risk, poor sanitation, tripping hazards. Causes and risk factors: genetic and brain differences in decision-making, attention, and emotional regulation. Traumatic life events or loss. Sometimes hoarding starts after a crisis. Personality traits such as perfectionism, anxiety, or indecisiveness. Family history or learned behaviors from parents. Co-occurring mental health issues, particularly OCD, depression, or ADHD. Understanding these factors helps reduce stigma. How hoarding disorder affects life. Hoarding significantly impacts quality of life. Strained relationships and conflicts with family or roommates. Loss of privacy and social withdrawal. Financial stress from buying or maintaining excessive items. Physical danger and health issues from cluttered environments. Emotional distress, shame, and low self-esteem. Assessment involves clinical interviews and home visits to evaluate the extent and impact of hoarding behaviors. Differentiating from other disorders or normal collecting habits. Treatment. Recovery is possible. 1. Cognitive behavioral therapy (CBT) for hoarding focuses on improving decision-making, organization skills, and addressing emotional attachments to items. Includes gradual exposure to sorting or discarding possessions, helping to reduce anxiety. 2. Medications. SSRIs may be prescribed if hoarding symptoms coexist with OCD or depression, but medications alone often aren't sufficient. 3. Support and practical help. Professional organizers, peer support groups, and family education. Social services in severe cases to help mitigate health risks or housing concerns. Long-term commitment is needed, and setbacks can happen, but progress is achievable. Everyday coping and tips. Break tasks into small, manageable steps. Set regular times for organizing. Avoid buying new items without thoughtful consideration. Ration. Use sorting categories like keep, donate, or trash. Reward small wins and be patient with challenges. If hoarding causes distress, risks health, or prevents normal living, professional help can guide safe and effective recovery. You are not alone in this. Hoarding is a treatable condition, and your courage to seek help is the first step toward a freer, safer, and fuller life. One small step beyond fear unlocks a world of possibility. If this video brought you comfort or clarity, please like, share, and subscribe. Your support could inspire someone else to begin their healing journey.